What's your take, Jamie, on the latest statistics that we're sort of seeing and reading about in regard to the number of hospitalisations in the NHS across the whole of the UK? I'd be really interested to get your views on that and how that relates to previous years, pre-COVID, indeed.
Yeah, good morning, Richard. So we've obviously seen the headlines over the last few weeks since kind of mid-December with the Omicron variant in the UK, that this big rise in people going into hospital with COVID. And we were around 30, 40, 50,000 cases a day early on in December. And we're seeing the headlines of up to 200,000 a day. So because we now know the Omicron variant, and we were told this quite early on by South African scientists that it's a kind of a less deadly variant, because there's so many people, Richard, in the country now with Omicron or with COVID, we are inevitably going to see more people in hospital with COVID. So NHS England publish estimates each week on the number of patients in hospital with COVID who weren't actually in the hospital specifically because of COVID. And it used to be around 25 to 30%. But that now has been increasing since the kind of the rise of the Omicron variant. And it's around between 37 and 45% of all the patients now in English hospitals are in there with COVID, but they're not being treated for it. So that's an important thing to kind of have a distinction. Now, if we look at the intensive care side of things, the critical care side of things, we see no difference at all, Richard, in the number of patients in critical care over the last few weeks. So it's quite clear that this variant is not meant, leading to further kind of people having serious treatment. And
Indeed,
on the point you
just stopping you there, Jamie. Indeed, as I understand, the numbers in ICU are less than they were through all of November and much of October.
Indeed, and you asked the point around how many compared to previous years. So we get information published by the NHS each winter because they try to look at the kind of the winter emergency that we always have on the NHS. So on the 2nd of January, I've had a little look at the last 5 or 6 years, taking the latest figures that they've published, which was the 2nd of January. So we have 3,055 patients in England in critical care just gone, 2nd of January. Now, last year, where we had this big, massive wave of, where we had that kind of originally the Kent variant, it was 3,911, a huge number over what we'd expect. But let's look at that 3,055 now. In 2020, it was 3,075. In 2019, 3,064. In 2018, when we had a kind of a mutant strain of flu, 3,270, so a couple of hundred more. And in 2017, 3,101. So the numbers of patients in critical care in England's beds at the moment is lower than any of the 4 years leading up to the COVID pandemic.
That's absolutely fascinating, Jamie. And I think it's really important that we understand these numbers in the round, in the context, because otherwise individually they can sound frightening and scary and sometimes terrifying. But when you put it in that context, that we're basically at the same level as the 3 previous winters pre-COVID, then actually say, well, maybe that's just life as normal in a sense. More people will be in ICU every winter because it comes around every year. And very often it is the elderly who are likely to suffer more, isn't it?
No, indeed, Richard. And I think, if we were having the same conversation 2 years ago and we weren't talking about COVID, we were just talking about the NHS, I'd probably be talking to you about, huge pressures on the NHS because we just inevitably have had them every winter. And you could argue that that's down to a kind of the lack of good management of the NHS, not just from the management within the NHS, but the government themselves and the funding over, successive decades and stuff. But, it's quite clear that a lot of people are talking about, COVID patients are overrunning the NHS. You get headlines of unvaccinated COVID patients are overrunning the NHS, and the facts and the figures when you just stop breaking them down and looking at them. So those figures as well. Remember that like 3,000, it's only around 1 in 5 of the patients who are in the critical care beds, Richard, have actually got COVID. So the vast majority of them don't have COVID, and people seem to forget that because you can turn the BBC on an evening and you'll see the journalists on the intensive care wards, and they'll talk about COVID patients there, and I think the narrative people start thinking is that everybody's got COVID. They're all on intensive care wards. So just remember, the vast majority of patients in the critical care beds, even though they're no higher than a couple of years before COVID, they are non-COVID patients as well.
That's right. I like the glass to be half full, not half empty. I fear that the BBC's glass is always permanently empty and permanently broken, because they always give the impression that there's a huge crisis. But when you just put that simple context, so only 1 in 5 ICU patients have got COVID, and the numbers in ICU are the same as the 3 previous years pre-COVID, actually, I think many people would say, okay, it's another winter, no drama. Every ICU patient is an anxiety, but it's not a reason for lots of restrictions ongoing. And in a sense, I think it gives the confidence that we've got to get our lives back, we've got to push on, and we've got to talk about the other big challenges apart from COVID.
Yeah, and I think you get those people who are obviously calling for Boris to introduce more restrictions. And Rich, if we didn't have a pandemic where the government had to be kind of pushed into having restrictions to control it, and you look at last winter, it was significantly more patients. But you've got these people on the side of Boris, bring in more restrictions, please. They would have been calling for restrictions the last 20 years if they had their way. And if we'd been testing for the flu and cold viruses over the last 20 years, we would see a massive rise during the winter months. So that's not surprising. The good thing, I suppose, with Omicron, Rich, is that it's actually killed off these more deadly variants. So talking about the glass half full, yeah, we've got huge numbers of cases, but it's going around the country now, and it's basically making that kind of more deadly Delta variant non-existent. So I think we should be kind of rejoicing with the fact that this variant's come along, and it may even come along now to the point that we need to stop thinking about vaccinating the whole population every kind of 6 months. I think the head of the JCVI was saying it's untenable to continue to do that. And I think we had a doctor who was on a couple of days ago about mandatory vaccines. I know you're talking about today. And we do know that previous infections offer those antibodies that he was talking about. So, we've got a huge waiting list problem in the NHS.
Yes.
Getting rid of 100,000 staff is not going to help fix that. It's going to make it worse, Rich, I think.
So just coming on to staff numbers, now you mention it, and obviously there's concern about staff absence, either with COVID or that they're isolating, and it may be hopefully the isolation period comes down from 7 days to 5 days. We'll wait to hear on that over the coming weeks. But is there any data, Jamie, comparing staff absences in the NHS now, again, compared to pre-COVID years?
So we are seeing more absences now, Rich, compared to pre-COVID years. But if you're looking at actual absences, we've seen little change in non-COVID absences over the last month. And the vast majority of those, we've got more non-COVID absences actually than we have COVID. And the main reason for those kind of stress, anxiety, depression, and there's about 40,000 staff in England are roughly around that. So we have seen this rise in recent weeks in terms of the number of patients, staff in hospital. But if you go back to last year, we also saw a big rise around the January time, this time last year as well. The positive sign on the staff absences is that they're coming down in London now. So it could be that, give it a couple of weeks, a lot of people are obviously off because we're actively looking for COVID cases. And, they're damned if they do and they're damned if they don't. Because if they leave them go in, we do know there's a problem of patients catching COVID in hospital. So obviously, maybe it is good to keep the staff out. But ultimately, at some point, if Omicron is proven to kind of be this less deadly variant, we need to move to a position, Rich, where there's not a 5-day self-isolation period, there's a 0-day self-isolation period.
And that was why I was so fascinated by Dr. Clive Dix's view earlier this week, when he told me in his first interview ever here at Talk Radio that he felt that all testing should stop, so that, because essentially we don't test for flu. Jamie, whilst you've been on, you'll love this tweet that's come in from Peter. Jamie Jenkins puts these statistics into perspective. Our government, the BBC and MSM have suppressed all of this. I will never forgive Boris for this. So there we are. You've got a fan, Jamie, from Peter in Stevenage. And I think this is really important. Also, Jamie, have you got some data for us on excess death numbers compared, again, to the 5-year average? So, again, we can put what's happening at the moment into context.
Yes, Rich. So we're going through the pandemic, the very first wave, huge numbers of excess deaths, and they were predominantly, nearly everything was down to COVID because there was no immunity in the population. significant numbers of elderly people succumb to the virus, sadly. And we saw a similar situation kind of last winter when we had the kind of virus. So, but if we look at the last couple of weeks now, where we get the figures, so just to explain where excess deaths are, basically that's, you can look at the number of deaths in the country at the moment being registered and look at the kind of the pre-COVID numbers just to see, are we seeing more people dying than what you'd expect for the time of year? And over the last 2 weeks, we've seen around 3,115 more deaths in England and Wales than what you would expect. But if we start looking then how many of those were what have been the medical registrars putting down specifically to COVID, it's about 1,350 of them. So, we've got more non-COVID excess deaths going on at the moment than what we have with COVID, total number of COVID deaths. Remember, some of the COVID deaths, Rich, some of them may have sadly died anyway. But,
yes.
So we've got this problem with excess deaths.
So the last couple of weeks, there's a slight excess. I think the data I saw, Jamie, was about the last 10 weeks, cumulatively, it's almost completely flat in terms of compared to the 5-year average.
But when you start looking at over the kind of the longer period since the summer, Rich, what we are seeing is the excess deaths that are coming through the numbers. They are mainly made up of kind of non-COVID patients, and there's this fascinating. Well, I say fascinating, but it's a tragic statistic as well. In that we've had now since the start of the pandemic, almost 90,000 people have died at home in their private homes, above average than what you would have expected. It's a third higher every week. And ONS did some numbers on this. You never see these on witty imbalances charts when they're doing their briefing.
And that's the point. Angela's just tweeted in, Jamie, before we finish. Jamie, thank you for explaining the real data. Are these stats available to Downing Street? Because if they were, your predictions regarding the lifting of restrictions would be here sooner. I think Angela's right. Jamie, we're going to have to leave it there. Thank you so much for that. That was absolutely fantastic. That's Jamie Jenkins with some proper context about the real data.